Okay, so now we are going to look at spinal anesthesia and neuroaxial anesthesia. So first of all, looking at the anatomy of spinal cord, there is covering of vertebrae around the spinal cord. As you can see, there are different vertebrae like that are divided into cervical, thoracic, and lumbar vertebrae. There are 7 cervical vertebrae and 12 thoracic, 5 lumbar vertebrae. So laterally we can see there is atlas C1 axis C2 and cervical and thoracic vertebrae that starts from here up to here and then starts lumbar vertebrae. So the important thing that we have to memorize is for lumbar puncture or for spinal anesthesia we have to insert the needle at L4 L5 region. So it is the landmark which is the best for performing spinal tap. Then comes spinal cord and nerves. A spinal cord gives off nerves that are 8 nerves pair from cervical, 12 pair from thoracic, 5 pair from lumbar, 5 from sacral. And then down there comes cardia echina, and the normal structure of a spinal cord has pia mater, arachnoid mater, and dura mater. Now, while passing the spinal needle, there are the structures that are pierced. Okay, the structures that are pierced by spinal needle are skin, first of all, outermost, then comes fat, then there is a muscle, then supraspinous ligament, interspinous ligament, ligamentum flavum, and then epidural space, and dura mater, arachnoid, and subarachnoid space where CSF is present. So we have to aspirate first and then insert the spinal anesthetic agent. So this is a very important thing that one has to keep in the mind, the structures that are pierced by the needle while performing a spinal tap. So as you can see, there are different dermatomes. The purpose of spinal anesthesia, we have to block certain regions. So for that we have to memorize the dermatomes that are S1 and S2 for perineal region, and then L1, L2, L3, and then leg is L4 and 5, and foot is S1 and S2. So it is very important to understand that what type of block are we going to do, whether it is saddle block or it is T10 to whole lower limb block. So that is very important thing that you have to keep in the mind. And this way we can easily perform the block. As I already mentioned that when we perform spinal tap at L3 and L4 or L4 and L5, we are purpose is to block the structures that are behind T10 dermatome. So T10 is at umbilicus, and then we have to do anesthesia of the lower limb. And now dermatomes of nipples are T4, Z4 is T6, umbilicus T10, and pubic is T12. So this is very important to memorize in terms of anesthesia and the block which you one is going to perform. This one is a this one is a position which can be used for neuroaxial anesthesia, and there are some special checklist for performing neuroaxial anesthesia like a standard procedure: pause, or adequate personal present, and then patient fully monitored like BP, EKG, saturation of the person with his hydration level, blood requirement, HB, and all these things should be measured. Then airway equipment should be ready for oxygen, ambu bag, oral airways, laryngoscope, ETT tube should be ready for the patient, and then emergency and anesthesia drug box should be present in the room. Ephedrine and phenylphedrine syringes are should be present. Spinal anesthetic agents like bupivacaine and epinephrine should be present at the time. And then there comes different blocks for spinal anesthesia. So we insert the medicine of different veracity or density in anesthesia. Spinal anesthesia, there is a term that is veracity, which is density of the drug. Hyperbaric means more dense, hypobaric means less dense, isobaric means density is equal to CSF. So we are comparing the density equal to CSF. Those drugs who have more density means more hyperbaric will settle down, and those drugs who have less baricity will go upward. So in this way we perform the anesthesia by comparing the baricity like hyperbaric, hypobaric, isobaric. So this is very important, which we will be discussing in different slides. Then there comes the position for spinal anesthesia, a saddle position, saddle block, and which is and the mainly used for blocking the perineal region and pelvic region. It is done in sitting position. After injection of a spinal anesthetic agent, we have to sit the patient for 3 to 5 minutes for saddle block. It is performed in obese patient, pregnant patients, or patient with abnormal spinal curvature. We perform saddle block and ask the patient to sit for 3 to 5 minutes after injection of the spinal anesthetic agent. So as you can see, there is the spinal cord, and then there are different vertebrae. At L4, L5, we insert the spinal anesthetic needle. Here it is between L3 and L4, but the ideal is L4, L5. So needle is inserted into the subarachnoid space, and then we have to aspirate the CSF for confirmation, and then we have to push the anesthetic agent for anesthetic purpose. So there are different advantages and disadvantages of spinal anesthesia. Like, spinal anesthesia is cost effective, it is high, patient satisfaction is there, there is protection of reflexes, patient will be awake, only the desired area will be anesthetized, and then there will be less bleeding, return is safely, bowel functions will be there, safely returned, less incidence of nausea, and decreased postoperative pain will be there, and cognition impairment will not be there. While there are some disadvantages of spinal anesthesia, like difficult needle placement, sometimes it is difficult to pass the needle in calcified bones, calcified curvature of the vertebrae, or there is in kyphosis, or there may be chances of hypotension due to spinal anesthetic agent, or postoperative dural puncture headache, or postdural puncture headache will be there, urinary retention, infection, or failed spinal anesthesia can be there. So these are some disadvantages of spinal anesthesia that we have to take care. Another thing that we have to take care is about hemodynamic stability is there in the spinal anesthesia, airway intubation is does not required, or minimum oxygen exposure will be there in the patient. It is faster and rapid procedure as compared to the general or other methods of anesthesia. While general anesthesia, there is different type of surgical instruments operative, it is performed, and there are laryngoscopy, airway management is there, patient has to be unconscious fully for general anesthesia. So these are things that we have to keep in the mind for spinal as well as general anesthesia. As I already mentioned, the complications of neuraxial anesthesia is urinary retention, high block can happen, total spinal anesthesia and cardiac arrest can happen, or anterior spinal artery syndrome and ulnar syndrome can happen because of different nerve palsies. So this is the adverse effect. There is the back head, dural puncture leakage, post-dural puncture headache, diplopia, or nerve injury will be there, and then we have to take care of that. And a lot of complications are there for the neuraxial anesthesia, which are not desired for spinal and neuraxial anesthesia. So in this way we have to take care of the patient. And another one is that by injecting the spinal anesthetic agent, patient become hypotensive, and there is decrease in cardiac output because of sympathetic block. When vasodilation happen, decreased cardiac output happen. This is the thing that we have to monitor very cautiously to prevent hypotension and sympathetic overactivity, sympathetic blockade, to preserve the life. So we have to perform L3, L4 spinal tap, and then we have to insert the needle into the subarachnoid space for spinal anesthesia. So another one is neuraxial anesthesia, epidural anesthesia. Epidural is regional anesthesia, blocks pain of the particular area of the body. Epidural, it is the goal is to do epidural analgesia for pain relief rather than anesthesia, which leads to the total lack of feeling. Epidural blocks nerve impulse and lower spinal segment, results into decreased sensation of the lower half of the body. So this is a thing that you have to keep in the mind. This is a needle for epidural anesthesia, and we perform. Another one is caudal block, and which we will be discussing into the another slide. And so you have to take care of these things.